My name is Luis Rodriguez. I'm a filmmaker born and raised in Southern Oregon. This So Healthy project is among one of the most important things I've done. I definitely understand what it's like to be raised in poverty. I know what it's like to not have health insurance. I know what it's like to not get dental care as a child. And I definitely know what it feels like to be discriminated against. There are many people that have experienced this or are currently experiencing this. It's important that their voices be heard and that people understand what's going on in our community.
Not having health insurance meant not being able to see the doctor.
I'm the first one in my family to go to college. I understand how education impacts my health.
I've always had to translate for my parents at their doctor's appointments.
I always had to work extra hard in school just to earn the same respect as my peers.
I know what it's like to go through the stress that comes with experiencing discrimination.
I really didn't get much dental care as a child. I wish I would have.
Healthcare is a much more complex issue than we tend to believe. It's extremely important for people to understand and be aware of the things that are going on in our community and how it affects our health. They need to know this because we need to address it in order to achieve a healthier community as a whole. Our health is directly connected to our socioeconomic status. Those further down the spectrum run a much higher risk of experiencing serious health illness and even premature death. It is because of this that we must look at socioeconomic problems as health problems, which need to be addressed in order for us to achieve health equity, where everyone has the opportunity to live the healthiest life possible, regardless of who they are, how much money they have, and where they live. Most health inequities are directly related to the social determinants of health. We all know that age, gender, and genetics play a role. We know that diet, exercise, and unhealthy habits can affect us, but there's much more.
So Healthy is a coalition created to advance policy, systems, and environmental changes focused on the social determinants of health. There are many communities that face discrimination. We not only focus on racial and ethnically diverse communities, but also the LGBTQ community. Our coalition is focused on how do we empower that community to use their voices and speak up to the commissioner's office or to policymakers. We're speaking to communities living disparities and hearing their experiences in our area, the Rogue Valley. What these stories will do is help build our case to policymakers to say these people live next door to you and their experience matters.
We have seen a lot of disconnections in schools, in hospitals, in clinics. And I think the disconnection comes with the training, the lack of knowledge, the lack of giving opportunity to other people to have access to their services.
High school completion and college attainment is directly related to health outcomes.
There are lots of reasons these disparities exist. K-12 education is a system that's largely designed based on white, educated people's values. And those values are not necessarily taught explicitly to the other population, so they may not know how to navigate the system. It's not that one culture is better than the other, but they're different. The other piece that we have to face is that there is racism, and that is a factor. There's a range of difference of 16 to 20% in terms of academic achievement on state test scores for those populations. The same is true for dropout rates. They tend to be maybe even as much as double, especially if we look at Latino males, African American males. And the same is true for discipline data. If we look at expulsions and suspensions, there's disproportionate data on the side of minority populations.
In Jackson County, we're growing with our racial populations and cultural diversity, and it's good to understand the different groups within our community, whether it's the LGBTQ community, whether it's the Hispanic community, the African American community, all are underrepresented population within Jackson County. That relationship is so key in our community, across the nation, however you want to look at it, that we need to continue to train our deputies to be able to provide the appropriate resources so we can make those connections and we can solve problems.
Teens of color have 1.5 to 2 to sometimes 3 times the rates of teen pregnancy than non-Hispanic whites. The good news nationally and in our community is that the rates are dropping of teen pregnancy in general over the last 14, 15 years. But the concern is that the gap is not closing between the different groups. groups. Teen moms are more likely to live in poverty. Teen moms are also less likely to complete their educational and career goals.
Because there is a disproportion in teen pregnancy rates, one of the things that we can do is maximize on the education piece and outreach that we do with youth and parents as well. We do have some really good resources here in our community. Unfortunately, people don't seek them because oftentimes people are unaware that those resources exist. I think people are really hungry for these things, but they're also very scared about what that looks like and what that could possibly mean.
Low health literacy obviously relates to a lack of communication between providers and patients. But if you don't even have the correct communication in the beginning, where you know that the patient is understanding and that the provider is understanding what the patient's trying to say, the outcomes are going to be poor. It is supremely important, in my opinion, that there is a trained professional medical interpreter, not just an interpreter. We've had history of people utilizing relatives or friends to interpret, and that is not appropriate. Again, the risk of serious medical misunderstandings, I mean, it's huge. You know, you could make an incorrect diagnosis. You could not have the patient understand how to take their medication. The consequences are very, very serious.
I've seen how conditions will progress and get worse when there's really no need if something would have been done sooner, real simple interventions. But because of the language barriers, cultural barriers that are between the healthcare system and the person that's receiving the system, there's challenges and it results in negative health outcomes for people that are totally preventable.
Anytime we can focus on those health disparities with those that are highest risk, we really improve the health of our whole community. So I ask agency directors to look at their board of directors. How diverse is that? Does that reflect the community? How does the executive team reflect the diverse community? How do staff that have advanced degrees reflect the community? And when you begin to see that, you begin to have a different conversation as a whole.
So the disparities we find in oral health in Southern Oregon are similar to those found throughout the state, and that includes a higher rate of decay and rampant decay for children living in poverty, and also for children of color, specifically Latino children and African American children. Oral health is very important for a number of reasons. It's the #1 chronic disease for children in Oregon. When children are in pain, they're not able to learn, and it does impact their education. The number of missed school days are significantly high for oral health reasons.
Resolving these unjust and unfair disparities that are happening in our community will not only strengthen our community for that small population of people who live here, but it's going to strengthen our entire economy, right? So our whole society will be better if we resolve health disparities for racially and ethnically diverse communities. The goal is for everyone to be a part of the solution, for us all to have these difficult conversations about race and discrimination, but now work collaboratively to make sure that our young people who grow up here have the chance to thrive. To strengthen our community and resolve the issues that are unjust and unfair in our society, we need every single one of you to play a part in that solution.